A silent threat. 12 signs that could indicate leukemia. Leukemia, medically known as hematologic malignancy, is a form of cancer that originates in the blood-forming tissues of the body, primarily affecting the bone marrow and lymphatic system. Characterized by the rapid production of abnormal white blood cells, leukemia impairs the body's ability to fight infection and disrupts the balance of blood cells in circulation. This condition can lead to a range of health complications, including anemia, bleeding disorders, and a weakened immune system. While leukemia can manifest in various forms, it is often categorized into 4 main types: acute lymphocytic leukemia, all, acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLL, and chronic myeloid leukemia, CML. Each type has distinct characteristics and impacts patients differently, depending on factors like age and overall health. Notably, the symptoms of leukemia can be subtle and easily mistaken for those of less severe illnesses, making early detection a challenge. Risk factors for leukemia include a family history of the disease, previous cancer treatment, genetic disorders, and exposure to certain chemicals and radiation. However, it's important to note that many people diagnosed with leukemia have no identifiable risk factors, which underscores the importance of understanding its potential signs and symptoms. The occurrence of leukemia varies globally, but it is one of the more common types of cancer among children and younger adults. Despite this, advancements in medical research and treatment have significantly improved survival rates over the past few decades. Early diagnosis plays a crucial role in effective treatment and management. To address this critical health issue, I will outline the top 12 signs of leukemia in today's video, empowering you to recognize and take action against this silent threat. Firstly, the primary sign of leukemia is persistent fatigue and weakness. If you're feeling unusually tired, regardless of adequate rest or sleep, it could be a symptom of leukemia. This fatigue is due to the lack of healthy red blood cells, which are crucial for transporting oxygen throughout the body. The body's energy production relies heavily on oxygen, so when these cells are diminished, it results in a chronic feeling of exhaustion. This type of fatigue can significantly impact daily activities and overall quality of life, making even simple tasks seem overwhelmingly exhausting. Secondly, frequent or severe infections are a common indicator. Leukemia cells can significantly weaken the immune system by overcrowding healthy white blood cells, which are vital for fighting infections. As a result, individuals with leukemia may find themselves getting sick more often or struggling to recover from infections that the body would normally fend off easily. This increased susceptibility to infections is not only a sign of leukemia but also a major cause of complications in affected individuals. Thirdly, a symptom to be aware of is fever or chills. These can be signs of an infection, which, as mentioned earlier, the body is less equipped to handle due to a compromised immune system. Persistent or recurrent fevers, sometimes without any other identifiable cause, can be a red flag for leukemia. These fevers can fluctuate and may be accompanied by other symptoms like night sweats or body aches. Fourthly, easy bruising or excessive bleeding is a sign to watch for. This occurs because leukemia affects the platelets in the blood, which are responsible for clotting. A decrease in platelets can lead to more frequent bruising, even from minor bumps or injuries, and can cause excessive bleeding from small cuts or during dental work. People with leukemia may also notice that minor wounds or cuts take much longer to stop bleeding. Fifthly, noticeable petechiae, which are tiny red spots on the skin, often in clusters, can indicate leukemia. These spots are essentially miniature bruises and occur when tiny blood vessels, capillaries, bleed into the skin. This symptom is closely related to the reduced platelet count in the blood and is often more visible on the lower legs. Sixthly, bone pain or tenderness is a sign to be attentive to. Leukemia cells can accumulate in the bone marrow, leading to pain or tenderness, particularly in the ribs or sternum. This pain is often described as a dull ache and can be a significant discomfort for those affected. It may worsen at night or during physical activity. Seventhly, swollen lymph nodes, especially in the neck, armpit, or groin, can signal leukemia. The lymphatic system is a key component of the body's immune response and is often affected by leukemia cells. Swelling occurs when the lymph nodes are infiltrated by these abnormal cells, and it may be accompanied by tenderness or soreness in these areas. Eighthly, unexplained weight loss can be a sign of leukemia. Weight loss in leukemia is often due to the body's increased energy expenditure in fighting the cancer and the reduced efficiency in nutrient absorption due to the disease's impact on the digestive system. This weight loss typically occurs over a short period and is often unrelated to changes in diet or exercise habits. Ninthly, excessive sweating, particularly at night, is another symptom. Night sweats can be so severe that they soak bed sheets, and while they can be caused by other conditions, in conjunction with other symptoms, they can indicate leukemia. This symptom is often distressing and can significantly disrupt sleep patterns. Tenthly, a general feeling of discomfort or illness, or a sense that something is not right with your body, should not be overlooked. This is a more subjective sign but is often reported by individuals before they are diagnosed with leukemia. This generalized sense of unwellness may be difficult to describe but is frequently a crucial indicator that prompts individuals to seek medical evaluation. 11th, anemia is a common sign, characterized by a reduction in the number of red blood cells. Symptoms of anemia include paleness, shortness of breath, and dizziness. Since leukemia affects the bone marrow's ability to produce healthy blood cells, anemia often results. Anemia in leukemia is particularly concerning because it can exacerbate the feeling of fatigue and weakness, further impacting a person's ability to carry out daily activities. Lastly, the 12th sign is abdominal discomfort or swelling, particularly in the left upper part of the abdomen. This can be caused by an enlarged spleen, which occurs when leukemia cells accumulate in the spleen. An enlarged spleen can also lead to a feeling of fullness or bloating, even after eating only a small amount of food, and can affect overall appetite and digestion. If you recognize any of these symptoms in yourself or someone you know, it's important to contact a healthcare professional immediately and request a complete blood count (CBC) test. This simple blood test is crucial in the diagnosis of leukemia. It measures the levels of various blood cells and can indicate abnormalities in white blood cells, red blood cells, and platelets that are characteristic of leukemia. For example, an abnormally high white blood cell count can be a sign of leukemia, as the disease causes the body to produce large numbers of these cells. In the United States, leukemia is relatively common. According to recent statistics, approximately 60,000 new cases are diagnosed each year. While this number may seem high, advances in medical technology and treatment have significantly improved the outlook for many patients. Early detection through blood tests like CBC is key to improving treatment outcomes. Leukemia, particularly in its chronic forms, may not always be immediately life-threatening, allowing time for effective treatment plans. Treatments range from chemotherapy and radiation therapy to targeted drug therapies and stem cell transplants. These treatments have become more sophisticated over the years, increasing the chances of remission and long-term survival. To address leukemia, let's explore 8 lifestyle modifications that can support treatment and enhance overall health and well-being. Nutrition plays a critical role in supporting your body during leukemia treatment. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains provides essential nutrients and strengthens the immune system. Antioxidant-rich foods like berries, nuts, and leafy greens can help protect cells from damage. It's also important to stay hydrated and limit the intake of processed and sugary foods. Incorporating these dietary changes can improve your energy levels and overall health. Start by gradually introducing more whole foods into your diet and reducing processed foods, setting a solid foundation for healthier eating habits. Regular physical activity is beneficial for leukemia patients, as it can boost energy levels, improve mood, and enhance physical function. Activities like walking, yoga, or light aerobic exercises, tailored to your energy levels and abilities, are excellent choices. Exercise helps in maintaining muscle strength, reducing fatigue, and improving cardiovascular health. It's important to consult with your healthcare team before starting any exercise regimen and to listen to your body, avoiding overexertion. Begin with short, manageable sessions and gradually increase intensity and duration as your body allows. Managing stress is crucial for leukemia patients. High stress levels can negatively impact your immune system and overall well-being. Practices like meditation, deep breathing exercises, and mindfulness can help reduce stress and improve mental health. These techniques can also aid in coping with the emotional challenges of living with leukemia. You can start by dedicating a few minutes each day to these practices, gradually increasing the time as you become more comfortable. Adequate sleep is essential for the body's healing and recovery process. Ensuring you get enough quality sleep can help manage symptoms of fatigue and improve overall health. Create a bedtime routine that promotes relaxation, such as reading or listening to calming music, and maintain a regular sleep schedule. Avoid caffeine and electronics before bedtime to improve sleep quality. If sleep disturbances persist, consult your healthcare provider for additional guidance. Staying hydrated is important for leukemia patients, as dehydration can exacerbate symptoms like fatigue and weaken the immune system. Aim for at least 8 glasses of water per day, more if you're active or undergoing treatment. You can also include hydrating foods like cucumbers, watermelon, and oranges in your diet. Begin by carrying a water bottle with you throughout the day to encourage regular sipping. Limiting alcohol and avoiding smoking are essential for leukemia patients. Alcohol can interfere with medications and treatment, while smoking can exacerbate health complications. Eliminating or reducing alcohol consumption and quitting smoking can significantly improve your body's ability to fight leukemia. Seek support from healthcare professionals for resources and programs to help with cessation. A support network is vital for emotional and mental health. Staying connected with friends, family, or joining support groups for leukemia patients can provide valuable emotional support and practical advice. Sharing experiences and coping strategies can help navigate the challenges of the disease. Start by reaching out to loved ones or exploring local or online support groups. Regular health checkups and adherence to treatment plans are essential. Regular monitoring of your health allows for timely adjustments to your treatment if needed. Adhering to prescribed medications and therapies plays a crucial role in managing leukemia. Keep an organized schedule of appointments and medications, and maintain open communication with your healthcare team. Each of these modifications can contribute to a stronger, healthier lifestyle, supporting your body's ability to cope with leukemia. Remember, small steps can lead to significant changes, so start with 1 or 2 modifications and gradually incorporate more as you feel comfortable. In conclusion, understanding and recognizing the signs of leukemia is just the beginning. Proactive management and treatment are crucial for improving outcomes. Modern medical advancements have significantly improved the prognosis for many leukemia patients. Treatments like targeted therapies and stem cell transplants have revolutionized care, offering hope and extending lives. These advancements are crucial, as untreated leukemia can lead to severe complications like organ failure, increased risk of infections, and eventually, it can be life-threatening. Leukemia symptoms can overlap with those of other diseases, making it important to get a proper diagnosis. For instance, symptoms like fatigue and easy bruising can also occur in conditions like anemia or clotting disorders. Therefore, a thorough medical evaluation is necessary to distinguish leukemia from other potential causes. The journey of managing leukemia has been transformed by technological advancements. Today, sophisticated diagnostic tools and treatment options provide a more accurate diagnosis and effective treatment plans. In contrast, in the past, the understanding of leukemia was limited, and treatments were often generalized and less effective. Decades ago, the diagnosis often came with a bleak prognosis due to the lack of targeted treatments and limited understanding of the disease's complexities. Historically, treatments were more invasive and less specific, often leading to significant side effects. The focus was mainly on chemotherapy and radiation, which, while effective in killing cancer cells, also harmed healthy cells and led to numerous side effects. Over time, research and clinical trials have led to the development of more refined treatment strategies that specifically target leukemia cells, minimizing damage to healthy cells. The progress in leukemia treatment over the years is a testament to the advancements in medical science and research. From a time when options were limited and outcomes often grim, we have moved to an era where personalized medicine, targeted therapies, and improved supportive care have significantly enhanced the quality of life for patients and increased survival rates. To learn more about this topic, please like the video and subscribe to my channel. I want to express my gratitude once again for your viewership and support in watching this video today. I send my best wishes for you to always be safe, prosperous, and happy. Please remember, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns.